Hello and welcome back to Unacademy. Myself, Dr. Muskan Chaudhary, and today we'll cover five random MCQs from the microbiology. So I started a series that is five MCQs for the day, and here myself, Dr. Muskan Chaudhary, your Unacademy NEET PG educator for microbiology. Now, coming to talking about the Unacademy, Unacademy, as we know, is that India's largest learning platform where we get access to both the live as well as recorded sessions. All right, and that too learning from the India's topmost educators for all the medical exams. We need PG, need UG for the Central Institute examinations, and we can access both the recorded sessions and the live. Because for the students who are working and for the aspirants who are the medical officers, it is quite difficult to maintain the consistency of the live class. They can actually watch the recorded sessions. And that too live T&D sessions so that we can evaluate a preparation, test a preparation with a highly competitive quizzes for the NEET PG. 25,000 MCQs are there for the NEET PG examinations, and we need to cover 50 to 100 MCQs per day, around 10 to 15,000 of MCQs, and PDF notes that are being provided by the Unacademy platform. Unacademy has come together with the PrepLadder, and we know that the PrepLadder is a very famous for rapid revision sessions and the QBanks and the video lectures with clinical and integrated essentials and the treasures and the notes with well-structured live batches from the Unacademy, recorded classes of the Unacademy, competitive TNDs, and comprehensive and the printed digital notes. With 12-month subscriptions, you get 2 month subscription that is totally free, and with 24-month, you get 4 that is totally free, and it is very economical and cheap compared to other coaching platforms. For subscriptions, I will recommend for those students who are in the second year and third year professional examination so that they can prepare simultaneously for the NEET PG examination as well as for the professional examination altogether. All right. For 1 year, it is 52K. For 18 months, it is around 57K. For 2 years, it is around 65K. For 3 years, it is 75K. And for 4 years, it is 85K. And you can use my code, that is Muskan10, to enroll into an academy, and to enroll into any subscriptions. You will get 10% of the discount by using my code. Yeah, 30 seconds. 30 seconds will be given to you. 30 seconds will be given to you. All right, 30 seconds for every questions will be given to you, and just let me know the answer. All of the following are having the super antigens property except Vibrio cholera, streptococcal pyrogenic, streptococcal enterotoxin, or none of these. I may be sounding some low because I'm not well actually. So just having throat pain. Please excuse me for that. Chalo, shall we discuss it now? All of the following are having the super antigen property, but which of the following is not having? So actually, the Vibrio cholera doesn't have the super antigen property. Vibrio cholera, whatever the manifestation of the Vibrio cholera, it is due to what? Cholera toxin. ठीक है, जो कि एंडोटॉक्सिन भी नहीं है, it is what? It is a protein enterotoxin, and it is having two subunits A and B. B is for binding with the GM1 receptors, and A is responsible for the toxin activity. For the toxin activity, alright, that will cause what? That will cause watery diarrhea or cholera. Please remember, it is due to what? It is due to the cholera toxin. In Streptococcus, first we talk about Staphylococcus enterotoxin, exotoxin, and TSS, streptococcal pyrogenic toxin. This is again a super antigens. All right. They are super antigens are produced by the pathogenic virus and bacteria, most likely as a defense mechanism. And TSST1 and epidermolytic toxin and endotoxin, they are super antigens. Now, what is the function of the super antigen? What does they do? They directly directly activate the T cell. That is, they what does they do? They do the polyclonal activation of T cell. इससे क्या होगा? Hyper gamma globulinemia. Now they act as a bridge. They act as a bridge between MHC class 2 APC receptors and the T cells. जनरली क्या होता है कि एंटीजन जब बॉडी में आता है वो पहले टी सेल के पास, पहले एक एंटीजन प्रेजेंटिंग सेल के पास जाता है, दैट गोज टू टी सेल रिसेप्टर्स टू टी सेल दैट विल फॉर्म द बी सेल एंड द एंटीबॉडीज. बट व्हाट डू सुपर एंटीजन डू? इट शॉर्टन्स द पाथ and it directly bind the APCs and the T cells, act as a bridge. You can see that is what acting as a bridge and causes the polyclonal activation through the beta variable region. Alright. Again, these are the important questions. There are super antigens. They activate the T cell. They activate the T cell directly. They activate the T cell directly and through the beta variable region of the TCR, and they directly bridge non-specificity between MHC class 2 and T cell. Alright, what does they do? They cause the B cell polyclonal activation and cause the hypergammaglobulinemia. Examples we need to remember, there are number of a disease, that is one is the TSS, another is the food poisoning and the scalded skin syndrome. Now most important are the examples that we need to remember. सबसे पहले start with the staph में 3 toxins, that is TSST1, के अलावा exfoliative toxin और epidermolytic toxin and the enterotoxin of streptococcus. ठीक है. नाउ एक्सफोलिएटिव टॉक्सिन TSST and enterotoxin. इसके अलावा 2 for the Yersinia, enterocolytica and the Yersinia pseudo TB and the mycoplasma. These all the organisms we have to remember it by heart कि staph भी है, strep भी है, Yersinia and the mycoplasma. Okay. Now viral superantigens. The only one fungal superantigens that we need to remember is what? Malacea fervor. Virus is what? EBV, CMV, HIV and rabies. Very easy. We are talking, that is the EBV, CMV, HIV and rabies. Now, another important question, super antigens causes the enhancement of the phagocytosis or the polyclonal activation of the B cells, or antigen presentation by the macrophage, or activation of the complements. 10 seconds only, because this is pretty simple questions, and just now we covered the function of the super antigen. ठीक है. तो सुपर एंटीजन कॉजेज व्हाट? सुपर एंटीजन कॉजेज द पॉलीक्लोनल एक्टिवेशन ऑफ द बी सेल. इसके अलावा व्हाट आर द अदर सेल्स एंटीजन्स दैट आल्सो कॉजेज द पॉलीक्लोनल एक्टिवेशन ऑफ द बी सेल? दिस इज वन बाय द सुपर एंटीजन एंड अनदर बाय द टी सेल इंडिपेंडेंट एंटीजन. उसमें क्या क्या आता है? सब बाहर बाहर आउट ऑफ द, वी रिमेंबर कि सब सेल के बाहर बाहर, दैट इज द कैप्सूल, flagella and what? Lipopolysaccharide. Capsule flagella and the lipopolysaccharide. All right, come to next question. Type A bioterrorism agent is chikungunya, anthrax, hendra or influenza. Okay, 15 seconds for this. Type A bioterrorism agent is what? So what is a type A bioterrorism agent? What is a type A bioterrorism agent? It is what? It is what? Anthrax. Anthrax. We need to remember. जब अपन Bacillus anthrax की बात करते हैं, what are the key points that we need to remember? That it is the most common. It is the most common lab contaminant, and it is the first bacteria that is seen under microscope. What is the another important point? That it is the first bacteria against which live attenuated vaccine was developed, and they are B4B, that are they are what? Bamboo shape, and they be B4B, that is they are non have the non bulging spores. Other important points about the bacillus is that key what is the selective media is the plat media, and they show what the frosted colony appearance, string of pearl appearance, एंड मेड्यूसा हेड कॉलोनी अपीयरेंस. इसके अलावा वो कैप्सुलेटेड भी है. बी फॉर बी दे आर कैप्सुलेटेड, बट वन दैट इज द एक्सेप्शंस, दैट कैप्सूल क्या है? पॉलीपेप्टाइड का बना हुआ है. एंड रिएक्शन दैट वी यूज टू सी द कैप्सूल इज व्हाट? मैक-फायदियन रिएक्शन by using the polychrome methylene blue stain. Polychrome methylene blue stain. It is a category A agent and considered to be highest risk among the category, that it is a bioterrorism, biohazard, and category B is the one that could be threatened the water and the food safety and includes the pathogens that are emerging. Category C are what? They are emerging infectious disease. All right, category A, B, and C. It is categories easily disseminated, highest mortality rate, and they require special action for the public health preparedness. Now, what are the category A? Most important is what? Bacillus. Next is what? Yersinia, that we need to remember. All right, category B is what? Category B is what? Brucella, Vibrio cholera. Category C is Mycobacterium tuberculosis. Okay, now next question. Four culture medias that is used for the E. coli 157H7 is SMAC media, Wilson and Blair, potassium tellurite in macroids medium, or DCA. In seconds for the question, what is the culture media that is used for the E. coli 157 and H7 serotype? Okay, so what is the culture media that is used now? Wilson and Blair media, the PT and the DCA. DCA is used for what? Salmonella and Shigella. Alright, PTA is used for potassium tellurate medium is for Corynebacterium, bacteria. That is a PTA media. That is the PTA media, potassium tellurite media, and the Wilson Blair media. Wilson Blair media that we use as the for the Shigella, and the SMAC media is used for the E. coli. For the E. coli. Now, talking about E. coli, SMAC is recommended for the selective isolation of the E. coli, and McConkey sorbitol agar, that is MSA. It is what it is based on the formulation described, and the medium contains the sorbitol instead of the lactose. That is a McConkey sorbitol agar is consisting of what? Sorbitol instead of lactose, and is recommended for the strains of the E. coli. Okay, and sorbitol fermenting strains of the E. coli produce the pink red colony similar to that of the lactose fermentation on the McConkey agar. Now this is sorbitol McConkey agar. Now pink colored colonies are being formed by E. coli 157H7. Now what is the indicator media? Indicator media is what we are using for what? Salmonella, that is reducing the sulfide to sulfide. Okay, indicator media, that is the Wilson Blair media, that is Blair media, that is the Salmonella, and Shigella we use the Wilson Blair media. Now the Salmonella will produce what? Will produce the black colored colonies. Will produce the black colored colonies. All right. And next media is what? Macleod's media, potassium tellurite agar media, that is for the cornybacterium diphtheria. They will also produce what? They will also produce the black colored colonies media. This is the DCA media. Okay. And DCA media is what? DCA media and XLD media, they are used for what? Salmonella and Shigella to isolate them from the stool. That is the DCA media and the XLD media. They will also produce what? The black colored colonies. Now, one more question, one clinical question that we'll also discuss. One clinical question that we'll also discuss is what? A 42-year-old female with gastric pain from gastric pain for 1 year. She was relieved after taking what? After taking antacid. That is, she is having what? Gastritis. But for short span of short span of time, when biopsy done for further investigation, when biopsy done of stomach for further investigation, comma shaped organism was seen. All right, patient was relieved. Patient was relieved after proton pump inhibitor was given and had good response to it. Okay. Now, question is what? The patient is having 42-year-old female. She is having gastric pain for 1 year, and whenever she takes the antacid, she is totally fine. When the biopsy was done, comma-shaped organism was seen, and the pain was relieved after PPI, and she had a good response to it. The question further says she further developed gastric cancer. Gastric cancer after few months, which is the etiological factor responsible for it. Now, what is the key factor? The patient has what options were? Options were flagella. Second option was urease. Third option was vacuolating toxin. And the fourth option was CAG A protein. So 15 seconds for the question. Question is saying that a female that she is what she is 42-year-old female. She first had the gastric pain that was relieved after taking the antacid. When biopsy was done, comma shaped organism was seen, and she got good prognosis with the treatment of the PPI. Later she developed the gastric cancer. After few months, now what is the etiological factor that is responsible for it? Flagella, urease, vacuolating toxin, or CAG-A protein, or CAG-A protein. What is the answer? The answer is what? CAG-A protein. The answer is what? CAG-A protein. Okay. Now, question stating that female is having the gastric pain that was relieved by what? Antacid, and showing good response to proton pump inhibitor, that the patient is having what? Gastritis. Is having what? Gastritis. And the organism, comma shaped organism is what? Pylori. H. pylorus. H. pylori. That is the comma shaped organism with what? Lophotrichus, with Lophotrichus flagella. Okay. Now H. pylori. H. pylori is what? H. pylori is what? Urease positive. H. pylori is what? Having the flagella and is what? Motile. Next is what? Next is what? They cause what? Carcinoma of stomach. And they are caused, the stain that we use for the staining is what? Warthin silver stain for the impregmentation to see the motility and the flagella. Alright, when we talk about the urease क्या करता है अपने आसपास का जो media, it further makes the media alkaline, and it neutralize the gastric acid so that the H. pylori can survive. So it neutralizes the gastric acid by hydrolyzing the urease to ammonia and CO2, and this ammonia makes what? The media as alkaline, that is supportive for the growth of the H. pylori, and is supportive for the growth of the H. pylori. Now, that is supportive for the growth of the H. pylori. All right. Now another is what? Another is what? H. pylori. H. pylori. As I told you, they are what? They are lophotrichus. They are what? Lophotrichus. That is having bunch of the flagella at one end. And also the spirillum. The spirillum is also lophotrichus, that is having the bunch of the flagella at one end. So they are highly motile. So they are what? They are highly motile, that will quickly penetrate and will colonize the gastric mucosa, and will make the pH alkaline by the help of the urease enzyme, and also release the vacuolating toxin that will form what? The vacuoles in the epithelial cells. तो एक काम तो यूरियस कर रहा है कि वो मीडिया को क्या कर रहा है? एल्कलाइन बना रहा है. दूसरा फ्लैजिला मोटिलिटी है तो वो हेल्प इन द पेनिट्रेशन. दूसरा वायलेंस फैक्टर ये हो गया. तीसरा वैक्यूलेटिंग टॉक्सिन is making what? Vacuoles in the epithelial cell and causing what? The apoptosis of epithelial cells. ठीक है. Now another valence factor, one is that we saw flagella, another we saw about urease, and तीसरा हमने क्या देखा? Vacuolating toxin. Now we'll talk about the CAG-A protein. CAG-A protein. Now CAG-A protein is having the triggering action. and the triggering of actin skeleton within within intoxicated cells within intoxicating cells, and catch a protein factor is what leading cause of oncogenic protein that is causing what the stomach cancer. So therefore, the answer will be CAG-A protein because this is a factor that is responsible for the stomach cancer. Urea is responsible for making the media alkaline. Flagella is responsible for high penetration of the increased penetration of the organism and regulating toxin, causing the apoptosis of the gastric epithelial cells. Now, one more question we'll discuss. One more clinical question that we'll discuss. Ki 63-year-old male presented with 63-year-old male presented with fever and watery diarrhea. Fever and watery diarrhea. ठीक है? Fever and the watery diarrhea with abdominal pain and nausea and nausea. 2 weeks later, 2 weeks later, he was admitted to nearby hospital. He was admitted to nearby hospital and was unable to speak, but was clinically oriented. ठीक है? Clinically oriented. Now, when neurological examination was done, bilateral muscle weakness was seen in legs, and within hours it was extending to arms. That is ascending weakness we are talking about. That is 63-year-old male that is presented with the fever, abdominal pain, nausea, and the watery diarrhea. And 2 weeks later, he was admitted for the unable to speak and the neurological weakness that actually started from the leg and moved to that of the arms. Now, he was further diagnosed with Guillain-Barré syndrome. What is the causative agent? Is what cytomegalovirus or the salmonella or what campylobacter or tetanus. Okay, so it's what cytomegalovirus or the campylobacter or the tetanus is Clostridium tetanus. What is the causative agent? So a patient, 62-year-old male, he was admitted and he was having nausea, vomiting, abdominal pain, and soon the neurological manifestation that was not seen because he was clinically oriented. But he observed the bilateral weakness first in the neck and leg, and then was extended over to the arms, and he was diagnosed with the GBS. So what is the causative agent? Now, GBS is caused both by the cytomegalovirus as well as the Campylobacter jejuni, but the clinical history of the watery diarrhea and abdominal weakness with the ascending paralysis suggests of what? Campylobacter jejuni. Now, when we talk about GBS क्या है? Autoimmune disease है of peripheral nervous system. And they show what? They show the ascending paralysis. Although the recovery is slow, but the prognosis is good. Prognosis क्या है? अच्छा है. Recovery slow है, but prognosis अच्छा है. And the ascending paralysis, and GBS is due to cross linking, and the cross reactivity Cross reactivity between what? Between the oligosaccharides, of the Clostridium and glycolipids of the neural cells. That is causing what? The GBS. It is due to the cross reactivity between the oligosaccharides of the organism and the glycolipids of the neural cells. Alright, the GBS is mainly seen in where? Clostridium jejuni. It is also seen in the CMV, and second most common reason for the GBS is what? Cytomegalovirus. When we talk about the Clostridium tetani, Clostridium tetanus, it is what? Having टेटेनोस्पाज्मी, जो कि क्या होता है? हीट लेबाइल टॉक्सिन होता है, एंड इट कॉजेज व्हाट? इट कॉजेज द इनिबिशन ऑफ न्यूरो इनिबिटर एजेंट्स, जिससे क्या होता है? इनवॉलेंट्री spastic paralysis. All right, and it causes exaggerated deep tendon reflex. Deep tendon reflex causes the lock jaw. ठीक है, opisthotonous position due to inhibition of the inhibitory neurons, inhibitory neurotransmitters that are responsible for the inhibition of the involuntary actions, and therefore inhibiting the movements, causing what? The lockjaw and the DTR reflex are increased. In case of the Salmonella or the Shigella, we do not see the GBS. We see what? Ritter's syndrome. Ritter's syndrome क्या syndrome है? किसका? तीन चीजों का, कब का? That is what? Conjunctivitis, urethritis, and P for what? Conjunctiva polyarthritis. ठीक है, तो सैल्मोना क्या है? सैल्मोना is having the Ritter syndrome. That is, the Ritter syndrome is what? R cup. ठीक है, that is R cup means अपना cup. That is what we are talking about, R cup. That is the Ritter syndrome having the conjunctivitis, urethritis, and polyarthritis. All right, that is having the reactive arthritis. So this was what? A short session. A short session. We covered the 5 to 6 MCQs of the day, and that were easy. Super antigen is very important topic. So do share, like, and comment, and please do use my code, that is Muskan 10, to get 10% of the discount. We'll take down the short sessions to cover the short sessions as well, so as to cover the topic soon. And short sessions are easy to remember, and they are it can easily be seen anywhere because it's around 30-minute sessions. And if you think the speed is slow, according to you, you can just increase the speed, or can decrease according to the convenience, so that you will be able to cover the session within short period of span. All right, and please use my code, that is Muskan 10, to get 10% of the discount, and to enroll into Unacademy, and to log in into the Unacademy. Whatever you want to do on the Unacademy, just use my code, that is Muskan 10, to get 10% of the discount. So I will see you soon, and take care, and bye bye.